Hi, my name is Leah from Indianapolis, Indiana, and I'm 20 years old. I'm interested in learning more about the abortion pill, RU-486. I want to know what the risks are and how it works.
Leah, RU-486 was the name that this procedure was given when it was still in the investigational stage in the United States. This approach, called medical abortion, meaning that you take a medication as opposed to a surgical approach, has been used in other countries since the 1980s, but it was approved in the United States in the year 2000. There's 3 steps. The first step is taking the first medication, which is mifepristone, and that blocks the hormone activity of progesterone, and progesterone is necessary to maintain a pregnancy. It has to be started within 63 days of the first day of your period, so it's an early approach for an abortion technique. You take this medication usually in the office of the physician who's prescribing it, and then 2 days later you take a second drug, usually misoprostol, but there are some other drugs that might be used. The second drug actually causes the bleeding and the cramping, which leads to the abortion. That can happen within a few hours or within 1 or 2 days, and that would generally happen when you're home. The third step in the procedure is when you come back in 2 weeks later and the physician determines whether or not this approach worked. There is a 3% chance that it will not work. So he or she will determine if you're still pregnant or if there's any tissue left. Some of the risks associated with doing a medical abortion is that if it doesn't work, you may end up having to have a surgical abortion as well. Or there might be problems like some bleeding, cramping, or maybe even a mild infection.